I think it's okay to ask for help, and it's okay to reach out, to not kind of suffer in silence.
Every woman will experience menopause, but did you know it can affect your heart? The extra measures one woman took to protect her heart based on her family history.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid, and welcome to All Things Heart. Here's what we're talking about today. Hot flashes and night sweats. That's nobody's idea of a good time, and both are signs of menopause. And if you're a woman, you've either gone through it, you're going through it, or you will go through it. Today we share the heart connection. And ahead of Mother's Day weekend, we are going behind the mask with these amazing doctors we have on our program who also happen to be moms and their moms. Your questions and comments, they're the heartbeat of every episode, so send them on in. You can connect with us on YouTube, Facebook, and the All Things Heart email. We are everywhere. You'll find those links right here on your screen. And now to menopause. For so many women, it's just there. It's looming in the future. And for most women, it happens in your 50s. But for some, it happens earlier. And for about 1%, it will hit you before you turn 40. Early menopause can come with risks and complications, including to your heart. The woman you're about to meet is doing everything she can to minimize those risks.
Amy Franken's in a good place. She has two beautiful sons, all grown up now.
So this is Cole. He is 27. This other one is our youngest, Alexander.
She has a husband she adores, a dad she loves looking after.
I have a 92-year-old father that I currently take care of.
And a sweet senior cat.
She thinks we can't see her if she's under the table.
Her life is full.
I mean, I feel healthier now than I have when I was 20.
And that's quite a statement considering what she recently endured.
Hysterectomy, which included removal of everything except ovaries, a prolapse repair, and a bladder sling, all in one surgery.
All Amy says courtesy of those back-to-back baby boys she gave birth to decades ago. The most worrisome being her prolapsed uterus, meaning her uterus had slipped out of place.
I had almost a 10-pound baby, and then 12 months later, a 9-pound baby. So I knew my pelvic floor was compromised because of that.
And in 2021, after enduring a slew of painful and uncomfortable symptoms, that's how she came to meet the University of Kansas Health System OBGYN, Dr. Melanie Meister.
She's wonderful.
After the surgery, Amy felt great physically, but it was the emotional part of menopause she wasn't quite ready for.
And there's some depression that goes with that, and some anxiety, and some, what does this mean for my life now? And you know, there's a lot of things to think about that you weren't really prepared for sometimes.
However, Amy is prepared for the increased cardiovascular risks that doctors say can come with menopause and early menopause, particularly knowing her own family history.
On my mother's side, all of the grandparents have died in their 50s of heart disease. Almost everyone has had a heart attack, has had heart disease, has had a high blood pressure.
In her 50s now, Amy is taking her health seriously, working diligently with her doctors to monitor for any signs of heart trouble. And she has no intentions of slowing down, planning decades more of adventures and travel. In the meantime, she has a message for other women.
I think it's okay to ask for help, and it's okay to reach out, to not kind of suffer in silence.
We are so pleased to have Amy joining us today. And Amy, that you're willing to share your journey with us is going to be a gift to so many women watching. We also have Amy's urogynecologist, Dr. Melanie Meister, in studio with me between patients. Thank you for being here. And also joining us between her patients is cardiologist, Dr. Shannon Hoos-Thompson, remotely. Thank you both for being here.
Of course.
Amy, I want to start with your case because it was very tricky. It was complicated. You had to have a hysterectomy before you stopped having periods. How are you feeling now, years after the surgery?
I feel great. As I said in my piece, I feel better than I have since I was in my 20s.
I had an extensive surgery, so I had a little bit more recovery. But once that was over, I just feel great.
Boy, that's wonderful to hear. Anytime someone feels better than they did in their 20s,
right?
That's a great sign. Did you have to go on hormones after your surgery?
Yes, Dr. Meister and I discussed that at length. I do take quite a bit of other medications for heart disease and high cholesterol. I'm also a type 2 diabetic. So we had to really cover all the bases there. But yes, I did do the estrogen patch. We had to adjust the dose just a little bit, but that has been fantastic for me.
And we're going to get to the heart questions in just a moment for Dr. Hoos-Thompson. Dr. Meister, I want to ask you about early menopause, though. Technically, what age is early menopause? What's the range?
Well, so I think we should start by talking about what is menopause, and that's really, we define that by 12 months without a menstrual period. So we have to actually define it sort of retroactively. Once a woman has gone 12 full months, then we say that she's truly in menopause. And in the United States, the average age is about 51 or 52.
Okay.
We consider it to be early if that happens before the age of 45. And rarely it can happen actually earlier than that. And if it happens before age 40, we actually call that premature.
Premature menopause. And that's 1% of the population?
Yes, that's the 1% of the population, right.
Wow. And so when premature menopause hits, does that come with extra risks to your heart?
It does, and likely that's because then that is sort of a prolonged amount of time without the beneficial effects of estrogen, which does come with some cardiovascular benefit.
I want to add some cardiovascular benefit.
Estrogen.
Okay, and we'll get to that in a moment. I want to go to Dr. Hoos-Thompson because there's a study that's in the European Heart Journal that finds women with premature menopause have a 33% higher risk of heart failure or cardiovascular disease, also known as CVD. Why is that?
So first off, I wouldn't put a hard number on it, but the association is very real. It's a bit ironic, or maybe it's full circle. As we developed our understanding of heart disease in women, one of the pioneer women who really kind of set the standard for, hey, we're not going to ignore women's specific issues in heart disease any longer, talked about bikini health care for women. So it was just the reproductive organs you would treat. But ironically, as we start to understand menopause, the hormonal changes and everything, regardless of when it happens, they're recognizing that these hormones affect things within the cardiovascular system and the amazing impact that can have immediate, but really more in the intermediate is long-term and how it changes, how it's not just a set thing. So the dynamics there are becoming better understood. And I think this article you reference is one of the articles that starts to put the insight into the hormonal effects on areas outside of the reproductive system, and the things that drive those hormonal changes can give us some insight into other areas of the body, like the heart.
I'd love to put that graphic back up so our viewers can get another look at it, because that was very powerful for me to see in writing. Dr. Meister, do you work pretty closely with cardiologists then in your profession?
Yeah, we do. We share a lot of patients between our practice and cardiology, especially those with underlying cardiovascular disease, and working to modulate their risk factors to hopefully decrease their overall risk.
There were also women in this study, Dr. Hoos-Thompson, who developed an irregular heart rhythm. So why would that happen?
So again, when you have major shifts in your hormonal stimulus, it doesn't just affect what's going on in your ovaries, in your uterus. It very much affects the vascular system. And so not just menopause, but we talk about women during pregnancy. So when you have major swings or major changes in your endocrine and hormonal therapy, hormonal status, we see changes there. And so it's just the reactivity and the responsiveness of different cardiac cells is what triggers some of those symptoms, like palpitations, like shortness of breath, same as it affects mood swings and things like that. So it's very real. And again, it is outside just one area of the body, and the dynamics of what it does in various tissues is really impressive and something we're still learning about, but our understanding has grown a lot.
Amy, one of the things that motivated you to really focus on your heart health is your family history of heart disease. Can you tell us again, because your family is really stacked when it comes to heart issues?
It is. I also am adopted, so I had to learn my biological medical history, which I was able to do, luckily. But there was a lot of heart disease on my maternal side. As I said in the piece, I think almost every single relative has died or come close to dying within their 50s of heart disease. So that's clearly a risk factor for me.
At what age were you when you learned that?
Oh gosh, I was probably
Were you young when you learned that, or late 20s?
Yeah, I would say late 20s, early 30s. It was after both my children were born, very shortly after that.
So I want to ask Dr. Meister and Dr. Thompson, when you have a patient like Amy coming in with a multitude of issues and this layered history of heart disease, what's the best course of action? What do you do differently with someone like Amy rather than someone without any history?
Well, you know, in my practice, a lot of this comes down to talking about those risk factors and what Amy and patients like her can do to modulate their risk as much as possible. Things like maintaining a healthy diet, controlling other medical conditions to make sure that those things like high blood pressure, diabetes are well controlled, making sure she's physically active, things like that. Amy did start hormone therapy. Hormone therapy is not actually indicated for prevention of cardiovascular disease, but you know, it does have some benefits that can be seen in that population as well.
And then Dr. Thompson, how common is it for you to have a woman come into you for a heart-related issue to discover it's tied to her menopause? I know you're not treating Amy, but is it common for you to then realize, oh, this is from menopause?
I would tell you in cardiology it's becoming more common because we are better able to associate or make the connections of, okay, how it's one more way to better specify to that individual patient in person about what it means for their cardiovascular health in a relatively short window of time, over the course of 5 to 10 years. So we treat what you know. And as we know more, we can treat more and control more or manage better. And I think that's really what's happening, is we understand better what menopause means and what it means to a specific individual when you put it into the scope of everything else that's going on in their body. When you talk about family history, being a diabetic, blood pressure, cholesterol, it's like, okay, where can we really go after things and how aggressive do we have to be? And I think our ability to again, not just broad stroke things, but be a lot more specific to that individual. And when we look, how we look, we can do so much better. And that's what I think is really empowering, not just to me as a doctor, but to the patient and to the people that they care about.
I bet it's also empowering, and Amy, to your credit, to have women like Amy that are just talking about it. I feel like menopause was this mysterious thing that happened when I was little. You know, I heard my mom mention it once or twice, but people didn't talk about it. And now so many women are feeling empowered to speak about it.
I think that's totally true. And, you know, I see women all the time who come to me and say, gosh, I didn't really realize how common this was until I mentioned it to my friend, and then she was going through the same thing. And so I think women helping women is really an important piece to the puzzle.
It's interesting because it feels like men have done a good job of talking openly about their health.
Yeah.
We see commercials for ED medications all the time on, you know, during the Super Bowl, but we don't see women in high-profile situations talking about menopause as much until now, which is it's really to Amy's credit. And I have a lot of questions coming in from our viewers that I would love to ask you. Ashley has a question for Dr. Meister. Ashley wants to know, is there a genetic component to early menopause? My mom experienced early menopause. Does that mean I'm more likely to as well?
That's a good question, and yes, there is likely an underlying genetic component. We do know that women tend to go through menopause around the same time as other women in their family. So around the same time as their mom, or if they have older sisters, their average age of menopause is at about the same time. For women whose family history is notable for early or premature menopause, they may also be likely to undergo menopause even earlier. So it would be worth having that kind of conversation with your doctor.
Jody has an interesting question. She wants to know, what about late menopause? Is there such a thing as that?
Yes, there is.
What's late menopause?
Technically, we define that as if women are still having periods by the age of 54.
That would be annoying.
Yes, it would be annoying. You know, and that said, Sometimes menstrual irregularity can occur, and so it might not be that you're having normal periods. And so if you're still having periods when you're getting to age 53, 54, that would be another thing to talk to your doctor about. Make sure there's not a reason to work up any abnormal bleeding.
If there's nothing abnormal going on, is there a danger to not going through menopause until your 50s or late 50s?
There's not a danger as long as it's truly just ongoing ovarian hormone production. And there's not a danger to that.
Okay. Leslie has a question for Amy. Leslie wants to know, this is a great question, how did you handle the news that you had to have a hysterectomy, easy for me to say, along with the heart concerns? That seems like a lot to deal with emotionally.
Yes, it is for sure. I don't think I had much of a choice since I did have a prolapse, so I knew that this was something I needed to take care of. It was a big surgery, about 6 hours, so it was a lot to take in. There's an emotional component to hysterectomy as well. It just feels like kind of the end of a certain part of your life and the beginning of the next part of your life. And so I think you just have to work through that a little bit. And yes, there's always concern with surgery, but when I think about all the other underlying factors like diabetes, heart disease, high blood pressure, things like that, it just adds that extra level of anxiety. So I think talking with Dr. Meister about that, kind of covering all those bases. I have a wonderful family medicine physician at KU that I think really brings that comprehensive feeling of healthcare together.
Who's your family medicine physician here? We should give them a shout out.
Oh, sure, Mark Meyer.
Wonderful. Dr. Thompson, got a question for you from Jill. If you experience early menopause, should you ask your doctor to refer you to a cardiologist?
I would say no, that's not an instant referral. But I would tell you one of the things I've become a lot more focused on is taking a menstrual history of my patients, finding out how old they were when they had their menses, has it been regular, have there been disruptions or issues when you talk about pregnancy health, and then as far as the timing of menopause and the process of menopause for that person and the symptoms or issues if they had any during that window. So there's several different windows or areas, the dynamic of what Dr. Meister does every day. My understanding of that, or how I use that then to cardiovascular health. But is it an instant consult to cardiology? No. It's a dynamic thing, and the fact that it may help us recognize that, hey, you may be somebody we need to be more aggressive with treating your risk or potential for cardiovascular events. It can do that, but I would tell you that we're doing a good job of educating each other, is doctors working with doctors, educating each other, where you talk about a good internist, family medicine doctor, your OB-GYN. All those people can do a great job up front, and if there is a point when there's other questions or things where someone like me can get involved, I'm happy to do it, but it is not a situation where you have to call your cardiologist first thing.
Okay. Gretchen writes in, she'd like just some clarification about estrogen and the role it plays. She asks about when your estrogen levels drop after menopause, how exactly does that increase your heart disease risk? And Dr. Meister, you had talked about how hormones can help with your risks, but what's happening when the estrogen drops that's increasing our risk of heart disease?
So I think that graphic actually that was up a little while ago was a really nice graphic to kind of describe all of the changes that can occur.
Got it. We're going to bring that back up too, so the viewers can watch along.
Yeah. So there's changes in cholesterol and changes in the vasculature, which all can increase the risk. Like I said, hormone replacement doesn't necessarily modulate that risk, but it is likely partly related to the low estrogen. That these risk factors come about.
Melissa has a follow-up. She wants to know, what screenings should I request after menopause?
So that's a good question. We don't necessarily have any specific screenings that we start once a woman is postmenopausal, with the exception of that premature menopause category I was talking about. Those women are, we usually screen for osteoporosis a little bit earlier in that population. In general, most of our healthcare screening is based on age and other risk factors. Menopause is sometimes one of those risk factors, but there's not sort of a blanket number of screenings that should occur once a woman hits menopause.
Vanessa wants to know, Dr. Thompson, are there screenings that you recommend as a cardiologist post-menopause?
So I would say if you haven't, or if you had before, a comparison or making sure you have a foundation of where your blood pressure is, because that is a time when blood pressure can shift, especially become high in women as they go through menopause or early after. Knowing your cholesterol levels, looking at your body weight and things like that. So they're not things that we necessarily would do different or add on to what gets looked at, but just make sure you're aware of where those things are. It's a great time in your life to make that transition, not just what happens inside your body, but what you're aware of is as far as things we already check, and that's your cholesterol, your blood pressure, your blood sugars. Knowing what those things are doing, it's a really important time to do that, because it's a great time to intervene.
Jill has a question for Dr. Meister. Jill writes, I've heard stories from all the women in my family that they all gained weight after menopause. Is there any way to keep that from happening to me? Is there any kind of medication I can take?
Oh gosh, this is a question I get all the time.
Is that a huge problem?
Well, it's very common. It is common to gain weight after menopause, and some of the strategies or techniques that women have used in the past don't necessarily work as well after menopause to lose weight or sort of maintain their weight. What I would say is, unfortunately, there's not a magic pill. There's not something I can say, yes, take this, and that's going to prevent any menopausal weight gain. But really incorporating those lifestyle habits, regular physical activity, being mindful of your diet and making good dietary choices can sort of offset that excessive weight gain, or it can attempt to. I also work closely with the Weight Management Center here, because there are now some emerging medication therapies that can be helpful for weight loss. But unfortunately, there's not one that sort of prevents all that excessive weight gain.
Or not one specific to postmenopausal women.
Right, exactly.
Maybe that's next in the
Hopefully,
pipeline.
That would be wonderful.
There's certainly a desire for women to have help with that.
Absolutely.
I have a question for Amy. You talked about looking forward to your husband's retirement and you traveling and things like that. Do you have any adventures in the future that you're really looking forward to?
We do. My oldest son's getting married in October, so we'll be doing that in Chicago, which we're looking forward to.
Nice.
And just taking some trips. We own a place in Arizona, so we're going to be traveling there quite a bit.
You're just going to live it up, and you truly feel better than you felt in your 20s.
I do. And I think I just wanted to mention again the importance for me of having a good family medicine physician. I've been with Mark since my first child was born, so 28 years with him.
Wow.
And so he knows every piece of my medical history. So he can really look comprehensively at all the different pieces. He referred me to Dr. Meister. He's referred me, I was having a little bit of joint issue with menopause. He's referred me to physical therapy. I've been referred to many different endocrinology. I also have a thyroid issue. So I've had a lot of care in specialties and subspecialties at KU. So it's just great to know that I can go one place and that he's going to be able to know exactly where I need to go. And all those doctors are talking to each other. So it makes a huge difference to have a doctor that I've been with a long time and that can really kind of ferret out all the different issues and get me to the right place.
And as we bring our whole panel in for our final thoughts, I also have one more question, Amy. For women who are feeling like they're embarrassed or they don't want to talk about it, you had such a good message in the story we showed our viewers about you've got to ask for help. Don't be afraid to ask for help if something's not right.
Absolutely true. I'm very lucky to have a good group of very close friends, girlfriends, that we can talk about these issues with. But I think having a great physician that you can discuss issues with, talk about things, it's going to happen to you at some point. So it's good to be able to discuss it, discuss your fears and concerns, and then you'll just be that much more relieved when you do.
No way around it. Got to go through it.
Yeah.
Dr. Meister, what would be your final thoughts for our viewers?
So even though we define menopause as that after 12 months of no periods, those symptoms, hot flashes, night sweats, vaginal symptoms, mood changes, those can start years before that last period and can even last for a while afterwards. And, to echo Amy, I don't think you have to suffer. I mean, it's worth talking to your doctor. There are hormonal ways, but also non-hormonal ways to manage those symptoms. And certainly there are people who can help.
And Dr. Hughes Thompson, as a cardiologist, you're very passionate about seeing the whole patient. And this falls along those lines.
Yeah, again, learning to incorporate and not just it's one thing to say, well, I specialize in cardiology, but being able to appreciate what Dr. Meister does every day, what our general physicians do every day, and knowing your limits as a doctor really help us a lot and really can empower us. So unless you're communicating with everybody, it's hard to be successful. So when it comes to things like menopause, it's a very natural thing. And so don't ignore it. And then there are things we can do to alleviate whatever issues it does or doesn't cause, and recognize what it means for you, not just in that window, but for your life to come.
Dr. Hughes-Thompson and Dr. Meister, you are two of the incredible doctors we have, just two of hundreds and hundreds. And our doctors here at the health system do such incredible things. But what are they like outside of work?
Now for a secret look into the guardians of healthcare at the University of Kansas Health System, let's go behind the mask.
It's time to go behind the mask. Let's start with Dr. Melanie Meister. And in honor of Mother's Day weekend, which is just ahead, Dr. Meister, look at this glamorous mama here. Yeah. Holy smokes.
Yeah.
Where are you two ladies in this picture?
This was at my sister's wedding. So we're all done up with the hair and makeup, but
beautiful.
She's beautiful, huh?
And what's her name?
Mary Jo. She goes by MJ.
MJ? Mm-hmm. Do you hang out with MJ a lot? Is she in town?
Yeah. Yes, she is.
Is she your bestie?
Yes, I'm pretty lucky. See her all the time.
We also have a picture of some of the little humans who made you a mom, and a big human who had a part in that as well.
Right.
Tell us who's in this picture.
That's my husband, Jeff, and our two sons. Sam is the little guy I'm holding, and Brecken is our 5-year-old.
Adorable. Do you have special plans for Mother's Day?
Not yet. Probably lay low. No, you're right, not that I know.
With two little ones, it might feel good to lay low. And now it's Dr. Hughes-Thompson's turn, because here you are with your beautiful children who made you a mom. Tell us about your kiddos.
Yeah, so you see Audrey there, who's my daughter, who's 16 and driving, and then my son, who is 8th grade, will graduate 8th grade here in a few weeks. So those are my two wonderful children taking me out for my birthday.
When was your birthday?
It was in April, start of April.
April, okay. And are they interested in medicine?
Not at all.
Oh, that's honest. Okay, well, I want to show our viewers your mom as well. Now, is your mom a doctor? Because I asked because you talked about how your parents, one time you shared, inspired your love of medicine by buying you a little stethoscope for Christmas when you were a kid.
Yeah, so my mom has been a nurse for 38 years. She was an inspirational lady, was a single mom who went back to school and became a nurse around the age of 30, and then she practiced nursing, especially inpatient ICU care. So her passion was when she would recover cabbage or post-bypass patients or heart patients was her passion, and that might have influenced me just a little bit. But she keeps me in line frequently that doctors don't know everything, and you need to pay attention to your nurses. And she reminds me on a regular basis of who needs, who everybody knows and doesn't know, and those things.
I love that. And what I love is because you're such a strong, smart woman, and I love hearing who would possibly keep Dr. Hughes-Thompson in line.
Yeah.
It's her mom. Moms keep all of us in line, right? That's wonderful. Well, thank you both for being with us today. And Amy, thank you for coming on and sharing your journey. It will help so many people by being open and willing to just talk about this. We got to talk about it.
Absolutely.
Or nobody's going to get any help. Thank you so much. Coming up next week on All Things Heart.
Go. Elbows in tight.
We only get one body, so might as well treat it well.
Amen to that. It's a prescription you can't fill at a pharmacy. Exercise as medicine. The providers who practice what they prescribe. That's next Thursday morning at 10 a.m.